Hello and welcome. Today we're diving into a rare and complex autoimmune disorder called Susac syndrome. This condition affects the brain, retina, and inner ear, leading to a unique set of neurological and sensory challenges. Join us as we explore the intricacies of Susac syndrome, from its potential causes to the latest advancements in its management. The exact cause of Susac syndrome remains a mystery, but it's believed to be an autoimmune disorder. This means the body's immune system mistakenly attacks its own tissues. In the case of Susac, the target is the small blood vessels, specifically the microvasculature, in the brain, retina, and inner ear. What triggers this autoimmune response is still unknown, though genetic predisposition and environmental factors may play a role. Susac syndrome's hallmark is microangiopathy, a disease of the small blood vessels. The immune system's attack damages the endothelial cells lining these vessels, leading to inflammation and blockage. This blockage restricts blood flow to the affected tissues, resulting in ischemia, or oxygen deprivation. The ischemia causes damage to the brain retina and cochlea of the inner ear, leading to the characteristic neurological, visual, and auditory symptoms. Susac syndrome is extremely rare. It affects individuals of all ages, but it is most commonly diagnosed in women between the ages of 20 and 40. Due to its rarity and the variability in symptoms, it can often be misdiagnosed or diagnosed late. There's no known racial or ethnic predisposition, but further research is needed to fully understand its prevalence worldwide. The symptoms of Susac syndrome can vary significantly from person to person, but the classic triad includes encephalopathy, branch retinal artery occlusions, and hearing loss. Encephalopathy refers to brain dysfunction, which can manifest as headaches, confusion, memory loss, behavioral changes, and even psychosis. Branch retinal artery occlusions are blockages of small arteries in the retina, leading to visual disturbances such as blurred vision, blind spots, or visual field defects. Finally, hearing loss is typically sensorineural, affecting the inner ear and resulting in tinnitus, vertigo, and decreased hearing acuity. Diagnosing Susac syndrome can be challenging due to its rarity and the overlap of its symptoms with other conditions. A diagnosis is typically made based on a combination of clinical findings, neuroimaging, and ophthalmological evaluations. Magnetic resonance imaging, or MRI, of the brain can reveal characteristic lesions in the corpus callosum and other areas. Fluorescein angiography, an imaging technique used to visualize the blood vessels in the retina, can identify branch retinal artery occlusions. Audiometry can assess the extent and nature of hearing loss. In some cases, a brain biopsy may be performed to confirm the diagnosis, although this is not always necessary. While there aren't distinct types of Susac syndrome in the same way we classify other diseases, the presentation of the syndrome can vary significantly. Some individuals may experience a monophasic illness, meaning they have a single episode of the disease, while others may have a relapsing remitting course, with periods of flare-ups followed by periods of remission. The severity and predominant symptoms can also differ, leading to variations in the clinical presentation. There is no cure for Susac syndrome, but treatment focuses on suppressing the immune system to reduce inflammation and prevent further damage. High-dose corticosteroids are often the first-line treatment, followed by other immunosuppressant drugs such as intravenous immunoglobulins IV, cyclophosphamide, mycophenolate mofetil, or rituximab. In some cases, anti-platelet medications like aspirin may be used to prevent blood clots. Rehabilitation therapies, such as physical therapy, occupational therapy, and speech therapy, can help manage neurological deficits and improve quality of life. Regular monitoring by a neurologist, ophthalmologist, and audiologist is crucial to track disease activity and adjust treatment accordingly. Currently, there are no known ways to prevent Susac syndrome, primarily because the underlying cause is unknown. If a person has been diagnosed with Susac, following the treatment plan prescribed by their doctor might prevent further flare-ups and organ damage. The prognosis for Susac syndrome varies depending on the severity of the disease, the promptness of diagnosis, and the effectiveness of treatment. Some individuals may experience complete recovery, while others may have permanent neurological, visual, or auditory deficits. Early diagnosis and aggressive immunosuppressive therapy are associated with better outcomes. Ongoing research is focused on identifying biomarkers for early detection, developing more targeted therapies with fewer side effects, and understanding the underlying mechanisms of the disease to ultimately find a cure.